Come in.
Hi, I'm Sheila from the Respiratory Care Department. How are you today?
I'm good.
So let me just verify your information. Is it okay if I see your wrist?
Yeah.
So what's your full name, please?
Dan Madrid.
And your date of birth?
11/4/84.
Perfect. Let me just go ahead and clean my hands and my equipment. Okay, so before anything, I need to start taking your vitals.
Okay.
So I'm going to place this on your finger, and what it does is it checks the amount of oxygen in your blood. Well, today what I need to do is teach you or instruct you how to use a high-frequency chest wall, the vest. And the equipment will be here. So what it does is basically it vibrates your chest and it helps loosen up the secretions in your chest.
Okay.
Okay, so let me go ahead and take the rest of your vitals. So I need to take some breath sounds. What I need you to do is take in a deep breath from your mouth, and then you're going to exhale through your nose.
Okay.
Is that all right with you? And then when I check, I have to do it in the front and in the back. So if I have it for the back, if you could sit up for me,
Yeah,
that would
I
be
can
great.
do that.
Okay, great. Go ahead and take your start. Take in a deep breath through your mouth, out through your nose, in 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 through your mouth, out through your nose. Perfect. Can I have you sit up, please?
Yeah.
Okay. This whole procedure, by the way, is going to take about 20 minutes. And I'm also going to be teaching you how to do this for yourself because you're going to have to bring this home for at-home care, okay?
Okay.
Perfect. Now we're going to do your back. Okay, inhale. Exhale. Inhale. Exhale. Inhale, please. Exhale. Inhale one more time. Inhale again. And again. Perfect. Okay. Now I just need to take your pulse rate. Looks good. Okay, now I'm going to start to teach you how to use this machine. Okay, so basically, like I said, it's a vest. What it does is it vibrates your chest, and you have a lot of sticky secretions inside all your lobes, inside your lungs. So what the vibration does is it unsticks it, and it helps it move straight to the carina, straight to the center of your chest, so that you can expel whatever secretions there are.
Okay.
So let me go first, get you fitted in one of these. Looks like this fashionably pink.
I like that.
Oh, that's great. So it looks like it's gonna fit you best. So let's go ahead and try this on for you.
Okay.
All right, so in order for you to put this on the right way, you put it on, like I said, like this. This flap has to be over this flap, like this. Because basically what it is you have to secure it because it has to feel like a bear hug. So you secure this tightly on, and you need to make sure that you're positioned the right way. So if you could sit up in an erect position. Okay, so these two holes are for the hoses. So I'm going to stick this on your finger because I'd like to monitor your vitals just to see if everything's okay. So you have to take this machine, and
Hey,
you're
look,
gonna.
it's bugs.
Yeah, usually we have it on little kids, poor kids, but anyhow, so you have to connect this to the vest, and the other side goes to the machine. Okay, before I even instruct you on anything, I need to ask you a couple of questions, and it's very important. Otherwise, if you answer yes to any of these, you can't use this. Have you had any surgeries, recent surgeries on your chest, or is there any fractures on your chest?
No.
On your ribs or anything?
No.
Were you diagnosed with any active hemoptysis?
No.
Did they diagnose you with any untreated pneumothoraxes?
I'm not sure. What is a pneumothorax?
Well, what that is when the air escapes from the lungs and it fills the pleural spaces.
Nope.
So you don't have it. Okay, perfect. Now we can instruct you on how to use this.
Okay.
All right. So before even turning on the machine or plugging it in, you have to make sure that the power voltage meets what this needs. And it's usually from anywhere from 120 to 200 volts.
Mm-hmm.
So luckily you're in the hospital, so we can supply that demand.
Okay.
Okay, so you have to turn it on. This is the on button.
Okay.
And okay, so this is the on button. You turn it on. You're gonna select normal.
Okay.
All right. All right. So on the first, this one will tell you how much it's vibrating.
Mm-hmm.
And usually you want to select 5.
Mm-hmm.
It goes all the way up to 10.
Okay.
This one tells you how much pressure.
Okay.
So we start off at 4, but it goes all the way up to 20. Also, this one tells you how many minutes. Now, like I said, usually the treatment it lasts for about 20 minutes.
Mm-hmm.
So we'll put this at increments of 10 because you're going to start to feel like you want to cough.
Okay.
And so you want to actively cough and spit it out, whatever secretions that is, because ultimately that's the goal. You want to take out all the secretions that you have inside.
Okay.
Okay? So we'll start you off at 10. Okay, now when I start this, first let's go ahead and make sure we adjust this vest to the right, because have one hand inside and you want to feel like a bear hug. Okay. How do you feel? Feels good?
Mm-hmm.
Okay, let's go ahead and start the treatment. Now, what you're feeling is the vest is starting to fill up. So you want to make sure that you're in the right position. Like I said, you have to be in an erect position, sitting up, because you need to have movement in your stomach because it's gonna expand. Now you're gonna press start again. And now it's gonna start to pulsate and vibrate.
Okay, I can feel the secretions moving.
All right, let's go ahead and increase the vibration.
This is fun.
Yes, it sure is. I'm glad you have that light of it, unique light of it. How does that feel?
It's weird.
Does it feel like a bear's hugging you?
Yes.
It's supposed to feel that way.
Alright, so what if I have to cough right now?
Okay, let's go ahead and let's pause the therapy. And how you pause it is you press off. It's gonna pause. And if you need a cough, go ahead and here's some tissue. Go ahead and cough. Thank you. All right, let's take a look at your...
That was a lot.
Let's take a look. Okay, you look good. Everything's looking great. Should we continue?
Yeah.
Perfect. Okay. You just press on again to resume. And like I said, it's going to take about 20 minutes. And if you need a cough, let me know. You have to cough it out because that's the goal. Okay. So it's been about 15 minutes. Okay, let's try to instruct you on how to cough, a really good cough, because like I said, you want those secretions to come out. So what I want you to do is put your hands on your thighs. I'm going to start disconnecting this so we can collect some sputum. Okay, if you can put your feet up. There you go. All right. Now what I want you to do is from inside your belly, you're going to cough. You're going to try to cough. And you're going to hold onto your thighs and you're going to try to get it from inside. You're going to You're gonna cough like, I'm sorry, pardon me, I don't want to cough in front of you, but like I said, you're gonna hold down, grin and bear it, and you're gonna cough real hard. Okay, and so whatever.
What if I plume?
That's okay, the nurse will take care of you. I just have to press this button.
Okay.
Right?
Okay.
Okay, so I'm gonna stick this right in front of you just in case you do have any secretions come out. Go ahead, feel free to have it all out on that, okay?
Okay.
Are you ready? So take in a deep breath and you're gonna very good. How's that feel?
There's some more.
There you go.
This is for you.
Oh, thank you. Glad I can help. Let's go ahead and disconnect the vest from you. Do you understand exactly what I showed you?
Yeah.
Okay, perfect. After this, I'm going to have you demonstrate how to do it just so I know that when you get home, you're doing it the right way. Okay?
Okay.
So let's go ahead and take this vest off. All right, now I need to take some vitals from you again, and I need to document them. So let's go ahead and get some breath sounds. Okay, like remember from earlier, you need to take a deep breath in from your mouth. You're gonna exhale through your nose, okay?
Okay.
So ready? Inhale, exhale please. Inhale, exhale. Inhale, exhale. Okay, looks good. All right, you're looking good. You're looking better. How do you feel?
I feel a lot better. I mean, I spit out a lot of the stuff that's in my lungs, so now yeah.
Feels good?
Yeah.
Well, okay, so you're gonna be going home with this. So I'm gonna need you to show me if you understood what I told you, what I
Okay.
taught you. Would that be okay?
Well, basically, all I have to do is put that on, make sure it's tight. Start myself low at what 4 cuff pressure, and then at 5 hertz,
Mm-hmm.
and then just go up to 25.
20.
20. Okay.
Mm-hmm.
So go up to 20, and if I need to cough, just stop it and then cough out the spit.
Okay, sounds good. And you know how to stop? How do you pause?
Off.
Off. Perfect. And then how do you start it again?
Oh.
And then what do you do at home before you turn this on or plug it in?
Oh, make sure that it's the right power.
Very good. Very good, sir. Do you have any questions for me?
No questions.
And you're feeling okay?
Yeah.
Okay, if you need anything, you press this button, the nurse is going to come and get you. Okay? Thank you for your cooperation and your patience. Let me go ahead and gel out. Thank you so much. Have a great day.
All right, thank you. Hi, my name is Dan,
And I'm Sheila.
and we're here to show you today different size vests for the chest physiotherapy chest vest. This is going to be your medium size for home care, only because of the fact that with home care, it's more comfortable for the patients to use this.
And also because of the fabric, it's different. It's a little bit more, it's more feasible for the skin. Now, this is for inside the hospital. It's easier to clean, but it's not as comfortable as the one for in-home. This is a size medium.
And Sheila,
The baby! It's for the infants or toddlers.
and this one is the large one for our XL size patients.
XXL.
And with all of this, all of them are basically the same thing. With the inlet ports right on the side, and for the baby, it's right on the side of the baby.
Literally.
All of them will be just the same. Inlets on sides. So we'll see you back next time.